Welcome. Thank you for joining us virtually for a press briefing. My name is Kelly Chandler. I'm the Public Health Division Manager for Itasca County. Itasca County has hosted press briefings twice weekly, focusing on themes emerging in our community related to COVID-19 or frequently asked questions posed by our community members. Following this press briefing today, we will scale back to hosting press briefings once weekly on Fridays at 10 a.m. We will provide twice weekly written updates for the media. Today, we will focus on oral health as Governor Walz and his team shift to the Stay Safe Minnesota plans and tiered reopening of businesses and services. We are seeing the reopening of preventative services, including dental care. We focus a significant amount of work in public health on prevention of disease. Our mouths are the gateway to our digestive and respiratory systems. Introduction of bacteria or inflammation in our mouths is linked to chronic conditions affecting our bodies. We have invited dental professionals and primary care to further speak on safely reopening their services, as well as the importance of prevention and oral health. We are joined today by Dr. Peter Miskovich from Miskovich Dental, Travis Ludke, Business Director from Scenic Rivers Health Services, and Dr. Dan Suler, Vice President of Medical Affairs and Family Medicine Physician from Grand Itasca Clinic and Hospital. We are joined by our local and regional media. After our speakers, please submit questions via chat. We would like you to preface your questions with your name and the media organization that you represent. Our panel will respond to the questions that pertain to their organization. Before we move on to our speakers, I will provide an update on COVID-19 numbers in Itasca County. We continue to have 51 confirmed positive COVID-19 cases in Itasca County per the Minnesota Department of Health. Exposures include congregate settings, healthcare workers, domestic travel, direct contact with a known positive, and community spread. And when I refer to community spread, that means the source of infection is unknown. We have not had any additional deaths since our press briefing on Tuesday. As we further reopen our businesses and services, we will continue to monitor the spread of COVID-19 in our community and provide messaging to limit further spread as best as possible. I will now introduce Dr. Peter Miskovich from Miskovich Dental.
Thanks, Kelly. Since the governor moved the order to elective dental procedures, and actually before that, the dental community has been meeting weekly for the last 6 weeks. We shared standard operating procedures. We brainstormed the way we would come back, because it's not the same as what it was prior. So for instance, if the doors remain locked, and we will meet patients at the front end, they have been screened prior to them coming, and we'll screen them again and take a temperature, and we'll walk them right back to the operating room. Although we can do elective procedures, we're still prioritizing patients on the symptoms that they have. So we'll see pain first, and then that trickles down to elective type procedures. The hygienists seem to be working throughout the community, although slowly offices are kind of starting with one hygienist first. And they're kind of working up week by week as they add hygienists. So patients are coming in and having prophylaxis performed or periodontal procedures as well with the hygienist. Offices are open throughout the county as far as I can tell, with conversations with various dentists throughout the community. Orthodontist offices are open as well, all kind of performing the same standard operating procedures for people to be safe. Incidentally, people are comfortable. They want to come in, they want to be seen. Not a lot of negativity, so people are feeling safe in the environment.
Peter, we're having a little bit of a connection issue with the sound. You're cutting a little bit in and out.
Oh, really? All right.
That's all right. You
I'm
sound
sorry.
It's a little better now, actually.
Was it me or was that the computer?
Perhaps a computer. If you want to keep going or hit on anything.
Go ahead. Yeah, if any, just we're good. Go ahead. You can move on. If it's
Sure, or I can jump back to you if you'd just like to double check the connection. That would be fine.
All right.
Sure. Sorry about that. I will jump to Travis Ledke, Business Director from Scenic Rivers Health Services. You're muted, Travis. Oh, there you go.
Can you hear me now? Okay.
Yes, thank you.
Yeah, so Scenic Rivers Health Services, we have 4 dental clinics kind of throughout northern Minnesota, specifically Big Fork, Cook, Tower, and Floodwood. All 4 are following pretty much the similar protocols and processes. Currently, they are seeing emergency dental patients only. And our goal is to reopen for elective care starting June 1st. And through the month of June, we'll essentially be prioritizing kind of higher priority dental care just because there is a backlog of dental patients obviously seeking care. We were originally hoping to reopen for elective care on Tuesday next week, but due to some PPE challenges in securing specifically N95s, we pushed that back. We have since secured enough American-made, not necessarily American-made, but American-approved NIOSH N95 masks. That was an initial challenge for us initially, as CDC actually restricted some of their alternate approved masks. So the next 2 weeks, next week basically is our practice run in which we'll have our staff exercise their new face shields and N95s and screening processes at the front desk. Hygienists won't be using a Cavitron. They'll be hand scaling when they're cleaning teeth in preparation for that June 1 start. And then we'll kind of see how it goes. That's basically where Scenic Rivers is at. I anticipate we'll be kind of backlogged for a while until we can kind of catch up. And with that is that's our plan.
Thank you, Travis. Dr. Miskovich, let's try it one more time.
All right. How was this?
That's good.
All right. So again, we've been meeting for, the dentists in the community have been meeting weekly for the last 6 to 8 weeks. We've shared operating procedures. Everybody has been open since March 17th when the original executive order was issued to emergency care only. And then this past week and then the week prior, people are slowly, in an organized fashion, coming back to work, meaning we're not seeing 40 to 60 people like we once did. Maybe it's down to 20 people. Hygiene has started in many offices. Like Dan said, mostly hand scaling only for prophylaxis and periodontal treatments. We have all of us in some way are screening our patients prior via phone, and then we'll meet them at the door and screen again, take a temperature, and then we'll walk them straight back to the treatment room. And then, as far as how things are going, from what I can tell, talking with colleagues, people are comfortable. Patients, staff, and dentists, things are working out very well. It's smooth. With the help of the Minnesota Dental Association, we were able to secure PPE throughout the community and state. Things are going well. It's actually a relaxed environment compared to what we're used to as far as the number of patients. Now that will increase as time goes on, but as we sit now, it's kind of a one by one, not 2, 3, 4, and 5 at a time. So that's it.
Thank you, Dr. Miskovich. We will now hear from Dr. Dan Suler, Vice President of Medical Affairs and Family Medicine Physician from Grand Itasca Clinic and Hospital.
Good morning, Kelly, and thank you for having me. And I want to thank our dental partners for working quickly and safely to resume care of their patients. We certainly appreciate that they have continued to care for all of our patients needing emergency dental care through this COVID crisis. But we recognize that preventative care is also very important, as it is in medicine as a whole. As the entry point to your digestive and respiratory systems, like you mentioned, Kelly, the health of your mouth has a significant effect on your overall health. We understand that oral health, or rather poor oral health, can contribute to various diseases and health conditions. Since the start of the COVID crisis, we've appreciated the local dentists and the partnership that we've had with them. They pulled together an on-call process to care for dental emergencies, so those patients could get dental care in a timely fashion and help relieve some of the burden from our emergency room while we were providing medical care to those that needed it. So we really appreciated that. That was something new and unique to our community. It was a great way for us all to pull together. In turn, we're trying to help support our dentists by providing fit testing, personal protective equipment to their staff. We've assisted with testing symptomatic staff for COVID. And we're also working with them to provide COVID testing for dental patients who are undergoing planned procedures, so that if a patient is positive, the staff can either reschedule to a more appropriate time or be prepared to care for them in a safe manner. Kelly will continue to work together with our dental partners in the community and other partners across the region to caring for patients in our community as safely as possible. Thank you.
Thank you. We will now move on to the question and answer portion from our media. Again, just please submit your name and organization you represent in the chat box, and we will address. We have Jennifer from ICTV. Do we have an idea of when you may start doing regular dental checks and cleaning? Dr. Miskovich, would you like to address that?
Sure. That's being done currently, although at a pace that is slowly ramping up, you could say. So, for example, in our office, we had one hygienist this week for cleanings and checkups, and we'll have the same next week. And then first week of June, we'll go up to 3, and then the week after we'll have 4, and that's going to vary. But from what I can tell, that's what, as a community of dentists, that's what we're doing, just kind of slowly ramping up. That being said, we're giving more time for those procedures, where once it used to be a half hour to an hour, now it's an hour and a half, so that we can turn over a room safely and effectively, and then and kind of get used to the flow, because with the addition of PPE, it slows things down. But to answer the question, we're starting now and it will become more available as time goes on.
Travis, did you want to speak on behalf of Scenic Rivers?
Yeah, we anticipate kind of a similar approach, increasing our capacity through the month of June as staff gets more comfortable with the new PPE that they're wearing. if anybody has any questions, the new PPE, a lot of the dental staff historically would not wear what's called an N95 respirator. They would have worn a level 1 surgical mask or level 3 surgical mask. But now they'll be wearing a bigger N95 respirator and a face shield, which can complicate dentistry as it has to work with their loops and lights. And so that's what Dr. Miskovich is probably talking about when we discuss kind of adding time to our appointments and easing back into the schedule.
Thank you. Kathy Lynn from KOZY. Since patients can't wear a face mask, how much more protective wear do the dentists and the hygienists need? And it sounds like you both touched on this. We'll start with Dr. Miskovich.
So we divided treatments into aerosol producing treatments and non-aerosol producing treatments. The PPE, as Travis is saying, is the mask with a shield. That shield is very protective. So if there's a non-aerosol procedure, there's not a lot of splatters, not a lot of droplets. It's a relatively low risk procedure. With the aerosol producing procedures, which would be outside of the hygiene most times, unless they're going to use a Cavitron, again, typically an N95 mask, that's typically covered by the level 3 surgical mask, and then a face shield on top of that. Plus you have your eyewear on. So we're well protected. Everything stays in the room, so nothing leaves the room. And also there's also the HEPA filtration that will be coming on board too, to kind of reverse the airflow.
Travis, did you have anything to add?
Yeah, in addition to the HEPA airflow, Scenic Rivers we're looking at our air filtration systems as well, and hope to have those in place in the coming weeks. And then also we've increased the use of our gowns. We'll be changing. We've switched to water-resistant gowns for the dentists and assistant hygienists, and those will be changed out between every patient. That way we have little to no basically transmission from patient to patient. So that's another precaution that we're taking as well.
Thank you. Britta from the Herald Review, how long will the wait be for regular dental checkup appointments? Days, weeks, months? Dr. Miskovich.
That's variable, but it could be months because we just canceled 3 months or a lot of patients. So depends how you prioritize. We're prioritizing based on the level of the disease, but you know, some people got in this week that called this week, but it's going to be a while in most offices just because of the way we're starting up. But hard one to answer, but in our office, it's going to be anywhere from a couple weeks to 3 months.
And Travis?
Would be a similar answer to that, and I think everybody just has to remain flexible as we don't know what is going to happen with COVID numbers. We may see COVID numbers increase substantially, and that might reduce our ability to provide dental care, or we might see COVID numbers starting to reduce, and that increases our ability to provide dental care. And so I think the dental community is going to remain flexible and reacting appropriately to the COVID environment that comes in the future.
Thank you. Other questions from the media? Jennifer, ICTV, can you give patients reminders on how to take care of their teeth since they may be unable to get into the dentist for dental care in the near future? Dr. Miskovich.
Yes. In variable forms, online, and if we know the person, we can just conference call or Zoom and those kinds of things, so that teledentistry does take place.
Travis, did you have anything to add, or Dr. Suler?
The only thing I might add is, don't be afraid to call one of our dental clinics. If we can't get you in, we can certainly attempt to triage your dental situation. If you're in pain or just have a dental question, we will do our best to get your questions answered.
Dr. Suler, is there messaging that you might give from a primary care perspective?
I wouldn't have anything in addition to what my dentist tells me: brush your teeth twice a day and floss.
Thanks. Other questions? Okay, I am seeing none. Thank you so much for joining us for this press briefing.